Now, regarding the modifiers of crystallization, like what are the inhibitors? This side is the inhibitor, okay? And what are the promoters of stone formation? Let us understand the promoters first because there are very few promoters. Okay. Now, to understand the promoters, just remember promoters. So, if you find a protein, most likely that protein will be a promoter. Okay. So, if you find there is a glycoprotein or sorry, if you find that there is some glycoprotein, or you find there are some matrix protein, or you find there is tam phosphol protein, then you need to remember that these are promoters. But this is not always true. What about the tam phosphol protein? When you read tam phosphol protein, you are also going to find tam phosphol protein in this column. Okay, you're also going to find tam phosphol protein in the inhibitor. So it's both a promoter and an inhibitor. Then how do you remember, like what is the difference in the structure when it comes to so when it comes to the tam phosphol protein, remember the polymerized forms are the promoters. So there is another P. Okay. Okay. So the polymerized forms. So remember, polymerized forms are the promoters. The non-polymerized forms are the inhibitors. It's very difficult to remember. Now, promoters, what are going to promote the stone formation? There has to be a protein, either a glycoprotein or a polymerized form of the tam phosphol protein. Okay. Now, remember that if you find a peptide, peptides are small chains. Okay. Peptides are small chains of amino acids linked together, so they are not going to be a promoter. Okay, they are very small amino acids linked together. But when you find a protein, it's a long chain of amino acids, long chain of peptides connected together. So proteins are going to form a growth and agglomeration, aggregation of these stones much earlier. So they are definitely the promoters. If you remember it this way, your MCQs will never go wrong. Okay, remember it this way that the what are the promoters. Another way, I'll give you another way to remember the inhibitors, but don't make it a rule just for the sake of remembering till your exam. Whenever you find something ending with an ion, okay, if you find something is ending with an ion, then it is likely that this is going to be an inhibitor because inhibitor are supposed to have ion in them, inhibitors. Okay, so if you find, let me tell you, if you find a uromodulin, okay, it will be an inhibitor. But if you find a uromucoid, it will be a promoter. Okay, modulin will be an inhibitor because it has in. If you find a microglobulin, it will be an inhibitor. If you find a bicunin, it will be an inhibitor. If you find an osteopontin, it will be an inhibitor because all of them has IN, which stand for inhibitor at their end. So this is just for your to help you remember so that you don't confuse in your options and you confidently chalk out the knock out the wrong options. Okay, so this is just going to help you in your exams. And regarding that peptides and protein concept, suppose you take up a phosphopeptides, suppose you take up a pyrophosphates. So they are not a complete protein. Okay, they're just a few amino acids. So in that way you can remember, and so they are the inhibitors. Okay, but the promoters are going to have long proteins. I know this has been a long discussion, but this will help you when you solve these questions. I want somebody to volunteer now.